Thanks for loading up this episode of the World Extreme Medicine podcast, the podcast for health professionals from all walks of life who are pursuing an adventurous and extraordinary career. I'm your host, Dr. Will Duffin. Now, we love speaking to medics in our network that are getting in amongst it and making it happen. And in this episode, I'm speaking to Dr. Elizabeth Thorne. She's 28. She's a junior doctor. She graduated from St. George's Medical School in London in 2017, and she's now in her F4 year. If you're in the UK, you'll know what that means. And she's just applied for core surgical training, and she's been able to build expedition medicine into her career, including an interest in sports and exercise medicine. And Lizzie is a true medical maverick. Instead of joining the traditional training treadmill, Lizzie has escaped and taken part in lots of different overseas projects and expeditions, including medical cover for sporting events in Jordan and Sri Lanka. And she was a core member of the WEM medical team for filming of the world's toughest race with Bear Grylls out in Fiji. You can find Lizzie on Instagram at the Adventure Doctor, and she's currently out in working in the emergency department in George, which is in the Western Cape of South Africa, which is where she's joining us from now. Lizzie, hello and welcome.
Hi, thanks for having me.
It's a great pleasure. Yeah, I'm good. I'm good. Now, I'm just seeing on the screen, it's blazing sunshine outside. And I understand you've been out already on a spectacular morning run. Tell me how that went.
Yeah, so at the moment there is a semi-lockdown here. There's a curfew from 9 p.m. to 6 a.m. So we usually set off at 5:15, but currently we're setting off at 6. And yeah, we just run as the sun's rising and through the Whitfontein Mountains. Yeah, it's amazing. It's very different to the London streets I'm used to running on.
Yeah, bashing those London streets. It's great that you've got the outdoors there and you're making the most of it.
Yeah.
So Lizzie, we'd love to hear about your career so far and some of the opportunities that you've created for yourself and why you've chosen the career route that you have. Let's start with one of the coolest things you've done recently, which was working out in Fiji on the Eco Challenge, the world's toughest race. How did you get involved with that?
So yeah, that was one of the most incredible experiences I've been a part of. It was actually interestingly via social media. I was just scrolling through and I follow the WEM Instagram page, and I saw an advert saying they were looking for volunteers and doctors to go out and help create a medical team in Fiji for an event. And I thought, I was at work at the time and I could see the deadline was that evening at midnight. And I turned around to my boss and I was like, boss, I have to apply for this. Please give me extra half-hour break. I just have to. And I told him all about it, and they was very supportive. And he let me go and type up my application. And then I wangled another colleague of mine in to film me, because we also had to do a little 1-minute video clip, like introducing ourselves. So I sent that off. And I did not think in a million years I would be chosen. You know how everything goes through your mind. But my dad and mum have always raised me to be proactive and to always ask, because if you don't ask, you don't know, and then you don't get. And I was like, I'm just going to go for it. So I submitted my application with a very cheesy 1-minute video. And yeah, a few weeks later, I heard that myself and 3 other people had been selected, and it was ecstatic. I was ecstatic, yeah.
Great. So you ended up out in Fiji with the medical team, and tell us what that was like.
It was just fascinating, and it was really nice to meet other people that have an interest in expedition medicine and adventure racing, because sometimes you feel like you might be one of the only ones that doesn't want to follow the traditional path that is set out by like the NHS training system. And you think, oh, is this the right thing? Is this possible? Can I do this alongside training? And I met these wonderful, wonderful people who have been doing such interesting things for so many years. It hasn't jeopardized their career at all. And it gave me more inspiration to do things like this. Yeah, it was really lit.
Can you think of any particular medical treatments that you gave to some of the competitors? Can you give an example of what kind of things you were up against, you were dealing with when you were out on that particular race?
Yeah, so this race was a 10-day race, over 600 kilometers through the entirety of Fiji, running, cycling, climbing, canoe, everything. And they were going through dry terrain, wet terrain. And ultimately, when you're putting your body through that much strain and in the wild, with everything that you're going to use on your back, ultimately, there are going to be injuries, there are going to be dehydration, there's going to be just multiple things that they're up against that they might require medical input for. And there's a big range of competitors, people that do adventure racing for a career, and then people that have entered into adventure racing for that trip. So initially we had training in rescue techniques, and we actually had a helicopter rescue training whereby they taught us how the helicopters work and how we're sitting in them and we're using the headsets, but then also going on from that, how to then be suspended from a very tiny wire to go down into a place that might not be so easily accessible by land, to then go in and help someone who might be injured or requiring medical assistance, and to then also attach them to what's required to then also be heli-lifted out of that particular area. And
So you actually got to be dangled from the helicopter on the wire.
Yeah,
But that was fun.
It was very fun. Terrifying at first because you're thinking, how can this tiny wire support me? And then they're like, okay, let's add another person. Oh, now let's add another person with a stretcher. And it's just, I know they do it day in, day out. These helicopter pilots can maneuver these helicopters so finely, considering it's such a big machine, very skillful. And that, and there were a few people that got injured and had to leave the race because of that. They couldn't continue. And there's also a few people that got infections and needed IV antibiotics rather than just simple oral antibiotics, and they got a bit poorly. Yeah.
Okay. And so you're out in Fiji, and you've done quite a lot of other medical cover for other adventure races. Give us a flavour of some of the other things you've done as well, Lizzie.
Yeah, so prior to Fiji, I had done a few treks. I had hiked up Mount Tukbul in the Atlas Mountains, and I also was a medic on a few ultra marathons where there's 50 to 100 people that have decided they want to run an ultra marathon. That's anything over marathon. And the ones I was a part of was stage ultra marathons. So overall, they ran 250 kilometers over 5 days. In different terrain. So one was in Sri Lanka, and another one was in Jordan in the Wadi Rum Desert. She'd gone from a very hot, humid environment to a very dry, sandy environment. I've also been lucky enough to be a part of a charity called Simon's Mango Tree, which set up by the anaesthetists and the surgeons at Norfolk Park Hospital. And they have a very close connection to one of the hospitals in Ghana, where they go out and offer their assistance in planned surgeries. They'll also help out if there's an emergency at the time, but their surgeons are quite capable of dealing with them because sadly, because they do have emergencies, that their planned procedures actually get bumped and the waiting list gets longer. So that's where that charity comes in to help there. So yeah.
You've done a remarkable number of different things, Lizzie, in a relatively short space of time. How have you managed to balance all of those overseas trips and opportunities with your kind of day job, if you like, with the work that you've been doing back in London hospitals in the UK?
Yeah, so originally I, of course, did my foundation year training. And actually after medical school was when I first did my first expedition wilderness medicine course to become more knowledgeable and more equipped to be able to then go on to become an expedition medic. And once I got my full registration after F1, I put feelers out, I sent emails, and I told everyone about my training, what I was doing. And then someone asked for my assistance along with a few other medics to do an ultramarathon in Sri Lanka. And I was still working a full-time rota at the time. And I just begged and pleaded all my colleagues and my rota coordinator that I could move my shifts around to get those 14 days off. And I've been very lucky. I had very supportive team members, very supportive colleagues that would change with me. And then following that, the ball just started rolling and I got more offers and more opportunities. And then I decided, rather than to go straight into training, I needed more time to be able to say yes to as many of these opportunities as possible. So I decided to take time out of training and go into what we call F3 year and a full year. And I'd always had in the back of my mind to return to South Africa after I did my elective here. So I started that ball rolling as well in F2 to start an application to work here as a doctor. So yeah.
That's really interesting. Yeah. So you started out on a kind of rota and you were kind of pleading with the rota managers to give you time off so you can go away, and it all got a bit tricky. So then you moved into being a locum, is that right?
Yes, that's correct.
So that gave you the flexibility to take all these opportunities, say yes more.
Yes, 100%, because luckily as a locum doctor, you choose your hours, you choose when you want to work, be it day shift, be it night shift, whichever you prefer. And I locumed at the hospitals I'd worked at previously, and they very welcoming. And so you know the system, you know the people that you're working with. If there's spare shifts going, they're on the apps that you use, or they call you or phone you, and you can say, yes, I'm free, no, I'm not free. And they also now know about the things I do extra. So they're also invested in me doing these things. So I was like, oh, I'm hoping to go and work in South Africa. And we met one of the managers in the A&E I work in the UK. It's like, tell me more, tell me all about it. When are you going? I need to live vicariously through you. So yeah, it's really lovely.
Yeah, it's interesting. It resonates for me, Lizzie, because I'm 36 now. I'm a GP. Like you, I made that transition away from regimented training, and I became a locum to allow that flexibility to take these kind of trips that you've been doing. And I've never looked back. I'm still a locum now, and it's great to have ownership of your time and not be beholden to the rota managers that don't, it can be quite a tricky negotiation, can't it, to get time off to do these things. Brilliant. So let's move now on to any top tips that you've got. So for other medics coming through, perhaps other junior doctors or medical students that are thinking, oh, I love what you've been doing, Lizzie. I'd love to have a more interesting and varied career. I'd love to pursue interests outside of just a kind of conventional clinical medicine. Have you got any other top tips for how they might follow in your footsteps, so to speak?
Yeah. So I think nowadays expedition and wilderness medicine is growing as an interest, if not a speciality in itself. Whereas when I was at university, I didn't really hear about being able to do these things until in my final few years, when I started to do a little Google search and work out what else I could do alongside medicine, because I'd recognized that once you decide to do medicine, even before that, your path is set for you. It's a very, like you say, regimented pathway whereby you go to medical school, you do your 5 or 6 years, or 4 if you're doing graduate entry. You then enter straight into F1, F2, and then you apply for training. You go, 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 go. And you don't really know if you can step away from that or if it's allowed, so to speak. So I started to look a bit more, and I love adventure, and I love travel and sport. And I saw there was an expedition wilderness medicine course. So I was like, I've got to do this. And even more so, it was half price for students. I was like, got to do it now. So I did it in my final, just as I finished my final year of medicine. And it was so intriguing and interesting. And you meet these people that have worked on shows, on trips, with Bear Grylls or David Attenborough, and they tell you these very entertaining, interesting stories. They also tell you about how to adapt to being in the middle of nowhere, how to make a stretcher out of 2 strong sticks and 2 rain jackets that you might be wearing. And you just get more and more pulled in, and more interested, and more wanting to be a medic that does something like this. So I would say join at university to any expedition wilderness or adventure medicine group there might be. I know now that a lot of universities, that students have started those societies. They weren't there when I was at university, but now even my university has one of them, the one I was at. Then look at a course you could do, and also look at opportunities you can do as a medical student. You can do your electives and these things. The Fiji World Challenge, World Toughest Race trip, we had 2 medical students that came along as well for experience, and they were incredible. They had the time of their life, and they've now gone back and they have these stories to tell, and they then have this inspiration to then go on and do something similar and tell others. Then once you've done your course, and personally as well, I wanted to be as prepared as possible. I knew that I was a very junior doctor, and I wanted to make sure that I had the capabilities to look after people abroad, if that was the case. So I bought books, I educated myself, I listened to seminars, I watched things online and things now that you can find on your web academy. You can look at them. And I made sure I had my ALS done. I made sure I had my ATLS. I've done basic surgical skills, because sometimes you do need to suture and do things out. I made sure that I had things available electronically on my phone for like quick lookups. So things like that. And then once you are confident, once you're happy, you pick people's brains, and you also then go on to tell companies that you are available to work with them, and send emails. You might not hear back. You might not hear back.
You've got to put it out there.
You have to put it out there. You have to say, I want to be your expedition medic for your trip. And they've probably got one already, but one time there might be that case where that expedition medic is on another trip, or they've got work, or they've got commitments. And they're like, oh, who was that person that emailed last week or last month? Let's see if they're available. Yeah. And then also you can look to see other people that you might know who work on these trips already, and they might be looking for someone else to go with them to help.
Yeah, it's really, I think the courses are a really key part of that. It's a great way to learn as well. If it's the kind of work that you'd be interested in, you can speak to people like Lizzie who've done it, and they've been there, and they can also help mentor you. When we provide, in normal times, loads of courses in the UK and overseas. So check out our website, worldextrememedicine.com, if you want to learn more about the courses we have on offer. But also you've touched also on the value of just getting out there and just making yourself visible, and being proactive in approaching potential employers, potential opportunities. I remember when I first started, like you, Lizzie, I just emailed every expedition trekking company I could find on the internet, and I just emailed them, and I think I emailed 17 in one go, and I think one of them got back to me and were like, yeah, we'll do an interview. And I ended up working for them for 4 years, and I went on loads of amazing trips with them, and it's great. That's Discover Adventure, and it was just incredible. So sometimes it's a numbers game, isn't it? You've just got to kind of throw it out there and see what comes back.
Yeah, absolutely.
Yeah, great. And you've also touched there on a key attribute of what makes a good expedition medic, Lizzie. You talked about that kind of adaptability, that versatility, being able to think slightly outside the box. Can you think of any other, really important attributes of what makes a good expedition or race doctor?
Yeah, I think, like you say, proactivity, being hardworking. It's not an easy job, because there's a lot of work to do even prior to an event. You've got to talk to all the participants that are going on it. You've got to do a medical health check. You've got to know the area you're going to. You have to know the resources of the area and what you are able to take with you and what you're possibly not able to take with you. From that as well, you've got to work out evacuation plans, and you've got to also talk to local hospitals and local rescue companies in case that might happen. So you've got to have organisation is a very key skill. Hard work, proactive. I think you've also got to be flexible. In medicine, we get taught a lot of protocols. This is the right way, this is the wrong way. So we become very used to knowing this is our pathway. But when you're doing a trek or an expedition, you have to be flexible with the company you're working with, because they have a service to provide. So you've got to really know what you are there for, and you are there to provide a healthcare provision. And so your priority is the health of the participants. the health and safety of the participants. So that's where you stand, and that's where your job is. So you don't want to like override or go above your area of your expertise. So you work very closely with the other people in the companies you're working with. I also think you've just got to be a friendly and approachable person. A lot of these trips, when planned correctly and all the trekkies have been done beforehand, or the recce's have been done beforehand, they should go smoothly. And most of the time you're happy and you're walking through this beautiful mountainscape and you don't expect many people to get hurt or injured. But there are people who sometimes suffer with emotional needs and mental health needs. And so you have to be able to be approachable for those aspects as well. It's not just emergencies and evacuations. So, yeah.
Yes, that's a really good point. Yeah, everyone looks at expedition medicine, thinks it's all casevacs with helicopters and you're spending your whole time dangling off lines, and it's all very sexy and high octane. But actually, the day-to-day is very different, isn't it?
Yeah.
It's often, especially with races, lots of blisters and foot care and some mental health.
Foot care is my bread and butter. If anyone asked me, I could not tell you. That's another tip to give people. Know how to deal with feet, because prevention is better than cure. Then teach everyone else on that trip how to look after their feet, because it will save you a lot of time in the whole trip.
Yeah, top tip that. And expedition or medical event cover opportunities aren't all the same, are they? Sometimes you have to be a bit cautious and you have to really scrutinize that opportunity to make sure that your involvement is it's safe and appropriate for you to be involved with that particular project. Can you give any tips to prospective medics who are weighing up an opportunity that they've managed to create for themselves? What kind of questions should they be asking that organization to make sure that it's a good one?
Yeah, so when I was starting off, actually someone said this to me and it stayed with me. As a doctor, you have trained, you've given up your social life, you've given up your hobbies sometimes, and you've trained for a very, very long time to get where you are now. And then you've also then paid for loads of extra courses. So you've paid for your education, you've paid for your courses, and now you've got an interest in expedition and wilderness medicine, and a company will be asking you to help them. But you've got to work out how they want you to work with them. And if they then come to you and say, okay, can you be our medic, but can you pay for your flights, pay for all the equipment and pay for all the medications? You've got to think, hold on, that's a lot out of my own pocket for a service that I am providing to then also help them and make sure that they can run their trip, because actually they've got a trip which requires a medic and they have to recognize the worth and value of having a medic on their expedition. And these medical kits, they are not cheap, and the medications are not cheap. And also, use by dates do not last forever. So I personally believe that you should never be out of pocket for doing one of these trips. When starting, you can do them for free, let's say, but as long as your trip is paid for in terms of the flights, the kit, the medication, the insurance as well, you have to get insurance. Don't go without insurance. Then it could be a good deal and appropriate for you to go. And then eventually, I think it's becoming, because these companies are earning money out of doing this trip. I appreciate charities are something completely different. If you're going with a company and you have to put bread on your table, and if you're not working, let's say, in a full-time job, then will be the time you might then say, okay, let's look at maybe a salary as well.
Yeah, I think there's really sound advice there, Lizzie. I mean, the majority, certainly in the charity trekking sector, there is quite an established kind of format. There's a whole network of medics that do that kind of work, and it's it's good and it's safe, and it's all the provision for medics is there. But there are quite a few cowboy outfits, if you like. There's a few different actors in that space who are looking to recruit medics who perhaps haven't used a medic before, and they might expect you to bring your own medical kit. They might expect you to pay for your own flights, maybe your own lodging. and perhaps expect you to operate outside of your area of expertise. And Lizzie, you rightly touched on the importance of working with at your level of competency. So if you're going to work in a very remote area where expected to deliver quite a high level of a high acuity of care, just think about whether that is the right trip, especially if it's your first foray. It's much better to go with an outfit that's much more established, that's used doctors before, and is going to take good care of you if things do go south on you when you're out there.
And on that note as well, in terms of if you are one of only 2 doctors on a trip or even one, going into this field and going to conferences such as the WEN conference, or going on these courses, that gives you a community that also do similar trips and also work in a similar field. And I've very much had consultants turn around to me and say, well, Lizzie, if you're stuck on anything, you phone me and I will help you. And you have to make sure you have the right communications in an area as well. So if that means getting a satellite phone, you make sure there's a satellite phone, GPRS trackers, things like that. So yeah, I've been very lucky in the support I have. And actually some of them are from your WEM faculty. So I'm very grateful for that.
Yeah, it's really nice to hear you say that, Lizzie. I mean, at WEM, this is one thing we really try to engender is that sense of community, and this sense that we're all coming at these very diverse range of different work opportunities from different backgrounds. You know, we're with nursing, paramedic colleagues are all here doing this kind of work as well, and there's so much we can learn from each other as a community. So that's a really key part of what we're doing here by sharing the love, sharing the knowledge, and supporting each other. Let's move on now, Lizzie, to what you're doing right now. So you are working in the emergency department out in South Africa. Now that must have been quite a transition from working in the NHS in London. Tell me what that move has been like.
Yeah, so I had always had a dream to come back to South Africa. I was here for my elective in Cape Town, and I actually did it in obstetrics and gynecology. So very different to emergency medicine and very different to expedition medicine, although some people might give birth on trips, who knows? That's maybe not the best time for them to go on a trip. But so yeah, and then as my interests developed throughout my foundation years, it's like, I have to go back. I want to go back. So originally I planned a trip that would last a year, but sadly this year we've seen the COVID pandemic. So that was delayed and had to be adapted. So now I'm here for 3 months, and I've come from a very comfortable setting where I've worked in the same surgical department, locuming, and the same 2 or 3 A&E departments back home, where I know the system, I know the consultants, I know the referral pathways and the people around me, to a brand new place in a brand new country, with everything is different, but also there are similarities as well. You still have referrals, you still have the computer systems, you just have to learn the new tricks of the trade and how to use them as such. What I would say is different here is they look after a lot more people in the A&E for a lot longer. So in the UK, we have our 4-hour target. So that means things have been streamed now to say, okay, you're coming in, I'm triaging you, I'm going to treat you acutely, and then you're going to go to surgery, you're going to go to max vax, you're going to go to medicine. Whereas here, for instance, if there's a stab wound and they have a hemopneumothorax, we will put the chest drain in. They will stay with us for 6 hours. We'll get them walking, get their lung re-expanding. We'll do another x-ray, or we'll remove the chest drain. And if they're okay, they'll go home. Whereas in the UK, a lot of the time, they will be referred because we can't have them in the A&E that long. So that's something that's slightly different for me. And I was like, oh, they're not being referred? Oh, okay. And it makes sense, you know, when you see these guys and they go home and they're fine, with safety netting advice. So that's something that's slightly different. Also, there's a lot more trauma here. There's a lot more infectious diseases here, a lot more TB, a lot more HIV, and a lot more non-compliance with medication, sadly, because the stigma still remains about those illnesses. And from then, obviously, they get AIDS, they get the complications of that as well. But what I would say is, in such a difficult time of COVID, they have fantastic referral pathways here to go to a TB clinic, or to a TB hospital, or even for the COVID prioritization schools they have here. It's very well done. Yeah.
So a few adjustments there from the UK system. You mentioned the trauma. Everyone thinks of South African hospitals, going out there in ED to get your hands involved in some kind of, some meaty trauma. Have you seen any knives or knife injuries or gunshot wounds or anything, any dramatic kind of things like that?
Yeah, it's quite a few.
Right.
I've gone so I work in a trauma centre back home, not a major trauma centre. So I've gone from seeing about 1 or 2 stab wounds a month. Never have I seen a gunshot wound in the UK personally. And I've come here and I saw 7 stab wounds in a day. I chucked in 4 intercostal drains to treat those hemopneumothoraxes in that first day. And we also saw a gunshot wound in the first week, who incredibly survived despite it nicking her aorta, her liver, and a kidney and her spleen. And I do not know how lucky she was. So lucky, and it was fantastic. A&E resuscitation, and then went straight through to theatres, and they had an explorative laparotomy, and she's now been referred to a tertiary centre. Yeah. Very young.
Yeah.
She was 20s. So very, very fortunate for her, and hope to make a good recovery. We also, I had a gentleman who was stabbed in his chest, lateral to his sternum, and it went through his heart. So I saw they did a thoracotomy, what they call a front room thoracotomy. It's sort of a last ditch attempt to save a life when they've lost, for those that aren't medics, that have lost output in front of you. There's an obvious sharp injury, and on the echo, on the ultrasound, you could see blood around the heart. And the surgeons were there, so the surgeons were called straight away, and they came, they sutured the heart closed, and we actually got return of spontaneous circulation as well. So that for me was phenomenal, because you hear about these happening, but you don't hear so much about it being successful. So things like that.
So lots of learning opportunities for you to really get a trauma experience out there as well. But this must be quite intense.
Yeah, it was a big change to see so much all of a sudden, and you just get on with it and you do it. But then when you do have a moment to sit back and reflect, and you're like, okay, that's now my life.
Wow, that's quite intense. So Lizzie, what's next then, do you think? So you've got 3 months in South Africa. Where would you like to see yourself in the next, say, 1, 2, 3 years?
Gosh, what a question. I want to continue doing expeditions. I am very much a person that if there is an opportunity, I would say to anyone, say yes, go through that door. Try it, find out what it's like, go for it. And if you don't enjoy it, then you don't enjoy it, and you can step away from it. For me, so surgical training, hopefully, with the hope of some flexibility to continue doing these trips. More and more now, because some people don't do the post F2 year, more and more people taking time out after core surgical training year 2, and I can bet your bottom dollar I will also take time out then as well to do something more like this. So I guess in 3 years' time I will hopefully be doing something similar to where I am now. Or
great. And on your Instagram, Lizzie, you've written your tagline is never stop dreaming and be kind. Why are these 2 things important to you?
Because if you don't have dreams or aspirations, then you don't know what to strive for, what to go for. And I appreciate sometimes you might not know what you want to go for, what to strive for. But for me, I just know that I want to be a medic. I love my job, and I want to be able to pass on what I'm able to do, thanks to the people providing me with my knowledge, with my medical license, to other places around the world. And I think being kind costs nothing. And I'm a big fan of nice people and kind people. Ultimately, if you're kind, that should then be responded to you. It should be reciprocated to you. And we actually had a brief talk today at work about how if someone calls you and needs help, don't berate them. Don't ask, why do you not think of this? Why do you not do that? They're calling you for help, for a referral, for advice. And you'd rather them put down that phone and feel at ease rather than feel upset, because that will then affect the rest of their day. So yeah, that's why.
So be kind to each other. Now, I think especially if you're working, I've worked in ED, especially if you're trying to refer a patient up into the hospital and you get a very austere, perhaps unfriendly specialist on the phone who gives you a Spanish Inquisition and may perhaps be unkind in that way. Yes, let's all be kind to each other, both in a professional sense and also in general. I concur. I think that's a really nice sentiment. But Lizzie, thank you so much for taking the time to speak to everyone on the podcast that's listening. For me, it's been great to celebrate what you've done in your career in bucking the trend, because there's increasing pressure for subspecialization and for that kind of linear training, for people to just continue up the training ladder, get all that training under their belt, get to the end of being a consultant, and that to be the focus. But you've shown that it's okay to step sideways and to pursue other interests. You're clearly not in any great rush. You're having a great career, you're having some amazing, enriching life experiences. And I think as a result of all of this, you're going to turn out to be a much stronger, more rounded clinician. You're going to be much less prone to burnout, and you're going to have so much more to offer for the remainder of your career. So it's been really inspiring to speak to you today. So thank you.
Yeah, thank you so much. Just to add to that as well, I remember when I told a colleague of mine that I wasn't going to go into training nor find a trust grade job after F2, she was petrified for me. She's like, but what if you don't find work? What if you then can't pay rent and get kicked out? And what if then you go to interview and they say, well, you've taken time out now, so you're not committed? It doesn't happen like that at all. As you said, everything you do that adds to you as a person, adds to your experience in your career, it will ultimately help you. And people recognize that, and more it's being accepted now to take the time out and to do these things. And I think they see how much it can contribute, it can help back to your job as you go forward. And there is no rush. Ultimately, when you're a consultant, you're a consultant. It doesn't stop you, and by rushing through, you still do everything, but by going slowly, it doesn't stop you from doing other things, from doing publications, from doing trips. But by rushing through, where do you go after that? You're a consultant, you still have enriching, complete things to do, but yeah, there's just something to be said for taking the opportunities and experiences as you go, rather than delaying them and putting them off till when you finish training.
So it's all about the journey and not the destination. You can find Lizzie on Instagram. She's at The Adventure Doctor, and there's some great pictures of all her trips and what she's been up to on there. And we've got lots more guests coming up on the Wemcast and also the Wem Academy live sessions. So check in with our Facebook page and on our website. There's lots more coming your way. So that's all for today. Thank you, Lizzie, and we'll look forward to spending some time together exploring more extreme medicine next time. Bye-bye.